This is my kinesiology interview, and I'm here with my aunt, who's a physical therapist. Thank you for doing this.
You're welcome.
What exactly do you do in your job?
I am a director of rehab. That means that I actually am over the physical therapy department, occupational therapy, and speech therapy departments.
Why did you choose a career in physical therapy?
Because when I was in high school, I took a kinesiology course, and I absolutely loved it. And I asked my teacher what profession would use this type of course for me, and he told me it would be physical therapy. And also, while I was in that course, my grandma had a stroke, and I actually saw her rehab through that, and that even gave me more interest in it.
Interesting.
That's fine.
How did studies in kinesiology benefit your career choice?
Well, it made me, I loved the kinesiology course, so it made me excel in that place, in that course, and so it benefited me in terms of being able to know the nerve innervation for the muscles and movement, and I mean what the course teaches you.
Yeah.
So.
How competitive is the field?
It's very competitive, actually. Physical therapy, you have to have a doctorate to be a PT. I'm actually a PTA. I'm a physical therapy assistant, which is a 2-year degree, and a PT is a doctorate. And you have to have over a 4.0 GPA to get into it. So.
Okay, those are obviously degree requirements. Are there any maybe specific certifications you have to have?
You don't have to, but you can. One of the things that I've done as a physical therapy assistant is actually become a master clinician in wound care. So I work a lot with pressure wounds, diabetic wounds, and venous insufficient wounds. That's one of my specialties that I do. There are people that can specialize in pediatrics, you can specialize in orthopedics. There's all types of areas, but you don't have to do that to be a physical therapist.
Yeah. What are the favorite elements about your job?
About my job now, I love patient care. I love seeing those patients come in that can barely get up out of bed or barely move, and get them to the point where they're actually able to get up and walk with either a cane or without an assisted device, and walk out of that building and go back home the way they were. And also the families that come in thinking their loved one's going to be in a nursing home forever, and lo and behold, within about 3 months, they're up and moving them back home, and never thought that would happen.
Yeah.
So seeing the progress and seeing how great they do is very rewarding to me. I love that part.
What would you say is the most challenging part at times?
When you can't make those patients better, and you want to, and those patients want to get better.
Yeah.
We have some that come in that don't want to get any better, and they could care less. But we have some that want so hard to get better, and they've had so much nerve damage, it's not going to happen.
Yeah.
And those are the saddest parts.
Yeah.
Of those.
What would you say is the most difficult injuries to treat, probably?
Any brain injuries are difficult because you can't really regenerate the brain cells or the nerve endings. Spinal cords are difficult. Challenging ones would be more of I think wound care can be challenging because you have to make sure that the nurses are doing what they need to do and the therapist is doing what they need to do in order to heal that wound. And if one person messes up for a day or two, it will back that wound up 2, 3, 4 days, even weeks, if they don't do it right. So you have to have really good communication with nursing and therapy to make that part work.
And lastly, what recommendations would you give for a student who's interested in the field?
Go do observation and observe in a hospital, observe in outpatient, and observe in long-term care. Those are going to be your 3 main areas that you can be a physical therapist in. A doctorate degree for a PT would actually, a benefit to a doctorate is that you can have your own clinic, and you can actually do therapy without a doctor's order for 30 days. That's the whole point behind a doctorate. And so find out if you like that. Do you like having to be able to have that freedom to determine what you want to do versus a doctor telling you what to do? As to if you're in a hospital or long-term care, then you're under a doctor's order. So you'll be doing what the doctor tells you to do.
Yeah.
But yeah, it's a fun field. It's very rewarding.
Thank you very much.
You're welcome.